Thank you. Time now 9:33. Obsessive compulsive disorder, or OCD, is one of the top 20 causes of illness-related disabilities worldwide. And now virtual reality is being used to expose patients to their anxieties and phobias in a safe and controlled environment in order to help reduce exaggerated responses. OCD specialist Andrew Colsky uses this practice on his patients and joins us today to share some insights on the new treatment. This is fascinating stuff. You and I were caught up talking about this just before the segment. So first, for those who aren't familiar, because I feel like OCD is kind of tossed around lightly, what is it actually?
So OCD basically is something where a person has obsessive doubt about something or a couple things, and as a result of that doubt, they feel the need to do some sort of a compulsion so that that doubt and the anxiety reduces.
And so it might sound counterintuitive to some, but you want to expose them in a way that's very managed to the actual thing that gives them phobia or triggers that OCD in order to better control their response. And that's where this comes in. So what is this virtual reality in this case?
So basically, when you've got someone with OCD, phobias, whatever, the basic treatment is exposure therapy. And exposing people to things is great when you can do it. But if you and I are sitting in my office and you've got an issue with crowds or dogs or public bathrooms, how am I going to do that?
You're not going to have all that stored in your office to expose them to.
Exactly.
And so this makes it fairly easy.
This makes it easy to do that. There's several different things that we can do. There's virtual reality, which is a virtual world created by computer, and you see a lot of people use virtual reality goggles. There's 360 photos. That there's cameras and equipment out now that I could take a 360 photo of us right here and put the person in it. And then there's augmented reality where I can actually take a picture of maybe a snake and drop it right here on the table in front of you.
And I wish you could show our viewers, but you were showing me on your phone the actual snake. It looked like there was a snake on the actual table. And that's when they put those the goggles or the lenses on, that is what they see.
Well, they don't even need the goggles for that. Like I showed you, you can see it on the phone. That's part of keeping the cost down of this. Is the less equipment you have to have, the better we can get more access to more people.
And that's my next point, because access is a big deal. I mean, this is great in theory, but what's the next step to make sure that folks can use this?
So we've been developing all the different types of technology, and if you notice, what I brought here is a pair of goggles, but these are not the $500 Quest goggles. This is something that I can drop my cell phone into.
Gotcha.
So the technology is in my cell phone that I already own.
And how quickly are you able to see results?
That's one of the reasons I got into OCD, because results can happen pretty quickly, meaning the average 3-4 months, I've had patients that have one appointment and it went away. Now that's not the norm.
Right, but it can happen. And give me examples. I mean, you talked snakes, you talked what else that can be used with this?
Anything. That's the beautiful. So we are incorporating artificial intelligence. So if you have a particular fear of a particular thing, I can say to the AI, give me this picture. As a matter of fact, I have a picture of a boy with a snake that was created by AI. And I said to the AI, give me a picture of a small boy in a field with a cobra snake ready to bite him.
That is just remarkable. It's a good example of how AI, can be used for good. There's that picture you were referencing.
There you go. Look how real that looks.
How we got to wrap here, but what's the timeline as far as in your mind for how soon this could be accessible?
So we're planning to launch our beta test of this in the next month or two, and if that goes well, as it hopefully will, then by the end of the year, we'll start using this.
How can folks get in touch with you?
So we've got a website, stopmyocd.com. And for this in particular, we call it Prescription XRT, and that's rxxrt.com.
Fascinating stuff and really important work that you're doing there. There was the information on your screen. Thanks for joining us this morning. Hopefully we can show an even more elaborate kind of visual example of what you're talking about.
Fantastic.
Thanks again.
Thank you.
Holly, we'll send it over to you.
All right, you know what I'm obsessed with? What's going on in